Okay, perfect. Welcome, everyone. We're very happy to have you here. Welcome to the American Congress of Rehabilitation Medicine, ACRM Technology Networking Group, Spring 2026 webinar. I am Dr. Chiel Yenu, and I serve as the webinar officer for the Technology Networking Group of ACRM. And today we have our speakers that are Mr. Alain Bagmi and Mrs. Cynthia Achu that will be discussing about using telehealth platform in clinical practice, design considerations, compliance, and care delivery implications. This session is being recorded, so please mute yourself, mute your mic, and turn your cameras off during your presentation. And we'll have a few minutes towards the end for Q&A. Before we get started with the presentation, I'm going to briefly introduce the speakers. I will start by Mr. Alain Bagmi, who is the founder and chief technology officer of MedZen Health, which is a comprehensive telehealth platform that integrates electronic health records, hospital management system, and secure virtual and care infrastructures. With more than 12 years of experience in information technology and cloud architecture, including 5 years in federal consulting and enterprise roles at Fortune 500 organizations such as Geico, he brings deep expertise in scalable, secured, and interoperable system design. Mr. Bagmi also specializes in HIPAA-compliant cloud environments, secure authentication frameworks, role-based access control, and data protection strategies that support safe and efficient telehealth delivery. His work focuses on translating complex technical infrastructures into practical solutions that enhance clinical workflow, improve care coordination, and expand access services. Through his platform MedZen, he is committed to advancing technology-enabled healthcare systems that prioritize compliance, usability, and high-quality patient-centered care across diverse clinical settings. We also welcome Mrs. Cynthia Achu, who is the co-founder of MedZen Health, where she leads the operational strategy and execution of digital health platform, focusing on improving care delivery and system efficiency. With over a decade of experience leading complex technology initiatives across healthcare, financial services, and global institutions, she specializes in building structured, scalable systems that support rehabilitation, workflow, data-driven decision-making, and AI-enabled care coordination. Mrs. Ashu is also passionate about ensuring that digital innovation in healthcare is operationally sound, secure, and designed to improve real-world patient outcome. So before I pass along to our speakers, I would like to let you know that ACRM conference for 2026 will be in Washington, D.C. in October 13 to 16. And please join if you can, and also join the technology networking group. And now I'll pass on the floor to the speakers.
Good afternoon, everybody, and thank you all so much for joining. Dr. Leonard, thank you for that very powerful introduction. We are so excited you all have taken some time out of your busy schedules to join us in this webinar. Like Dr. Leonard said, full disclosure from what you may have understood, we are not doctors, but we are going to be using a lot of language that will make us sound as doctors, and that will come from our experience and our relations with medical practitioners in our venture of building a telehealth platform. So we are just a group of people that are passionate about the technology and our team focuses on designing and deploying telehealth systems in real clinical environments. So what we're going to be talking to you today about is not just something which is a theory anymore. It's actually what is being implemented and is being used by real doctors as we speak. Now, across healthcare today, what we have realized is that clinicians are being asked to do way more than was the case earlier. Clinicians are being asked to do more complex tasks within less time. And there's an increasing distributed population of people. So clinicians have to do way more work than was done in the past. And at the same time, we do have patients that expect quality healthcare to meet them wherever they are. They want quality healthcare to be accessible at any time. They do want quality healthcare to be available whenever they need it. Now, if there's anything COVID-19 taught us is that that's possible. Today, we are able to order anything for that thing to meet us at our doorsteps. Now, how about healthcare? So more and more patients are requiring access to quality healthcare out of the walls of a clinic, which means we have to work on a system that brings this quality healthcare to the doorstep of every patient. Now, today, what we're going to be sharing with you is what we have learned building a telehealth system. We're going to share with you what works when we are building a telehealth system, what doesn't work, and especially what actually makes a difference in the clinical practice. Now, with that, let's get started. We're going to share a screen, and I'll just appreciate a thumbs up when you're able to see a screen share.
So just give me 1 minute. I'll put it on the slide. So that is it. So I'll start with this. Let me know when you can see. So can you see my screen? I just want a thumbs up.
Okay.
Okay. So then we go.
So what we're sharing the slides, so our expectation, what we hope, if you can go to the next slide, what we hope, we pray that you take away from this presentation is, as clinicians, when you're thinking of picking a telehealth system, the design considerations you need to look for when trying to pick an excellent telehealth system or when trying to design one. The next thing is where compliance, security, and regulatory limits come in when we're talking about telehealth. And the third thing is the different workflows you need to consider that will ensure a perfect patient delivery outcome. So our expectation today is that you don't just leave here with the facts that will be presented, but you leave here with an understanding of the entire framework. If we can go to the next slide. Now I'll pause here and let me take a step back. I've been using words telehealth, and you hear most times telehealth, telemedicine used interchangeably. And what exactly is telehealth or telemedicine when we talk about it? For the understanding of everyone here, and in simple terms, telehealth is just using technological devices like your phones, your tablets, your iPads, computers, to get access to medical providers anytime, anywhere. So just having that simple definition of what telehealth is, I'll just like to ask you for a bit, if you could go to the chat and just write, with the understanding of telehealth, what do you think are some of the reasons why somebody would prefer to use telehealth? You can just write that in the chat as we continue. But on the top of my head, what I think about why people would decide to use telehealth, the very first thing is the convenience, right? Why would I want to use, and I saw someone just put it there, thank you so much. Why would I want to use telehealth services? Why would I want to sit at the comfort of my homes and talk to my doctors? Of course, it's just so convenient for me to access the same service I will get, or the same questions I'll get answered when I drive 30 minutes to see my medical provider. I could do that from the comfort of my home. So convenience is the big one. Now, the next thing I will talk about is the stigma, right? We have a lot of stigma, especially in the environment where we built our application for. We built it for Africa. a lot of people, there are a lot of diseases out there that people are still looking to as a stigma. We're talking of diseases like mental health. People don't feel comfortable talking about mental health. And in Africa, diseases like HIV are still looked upon as a taboo. So when you go to hospitals, patients with HIV have to queue up on a specific side of the hospital. So if you see someone on that line, automatically you know they're HIV positive. So that stigma makes people not to want to go to see their medical providers. They prefer to die at home than to be seen as people that have this different health challenges. So those are some of the reasons, among many other reasons, why people will prefer telehealth today. And we're talking of infrastructural challenges. We're talking of access, security. So there are different reasons why people would prefer telehealth. Now, the three pillars of telehealth, we'll talk about accessibility, we're talking about care continuity, and then we're talking about making decisions based on real data. So when we look at all these factors, we come to a conclusion that telehealth is no longer optional, right? Telehealth is a care delivery model. It's exactly how care is one of the models that we need to consider of how care has to be delivered. If we can go to the next slide. So this slide just gives us some data on facts or evidence that proves that telehealth is something that people are leaning more towards. There is an increase in the adoption of telehealth. More physicians are getting to use telehealth. More patients are getting to use telehealth. There has been an increase from after COVID, an increase in the number of people that prefer telehealth. Hospitals now offer telehealth. A lot of hospitals now offer telehealth, and 82% of patients prefer the hybrid model, right? Where they can have access to healthcare from home and where they can also go to the hospitals to see their medical provider if need be. So there's enough data that shows that over the years, the use of telehealth will increase by over 30%. So this is exactly what we really need to lean into. If you want to go to the next slide, Alain. So now, what actually makes a good telehealth platform? As clinicians, when looking to build a telehealth platform or when sourcing for a telehealth platform to use, what are some of the considerations you need to look for? These things mentioned here on the slide. You need to find a telehealth system that facilitates virtual consultations. It has video, messaging, it has transcription and notes. You need to find a telehealth platform that uses the unified health record system. And we're talking about open electronic health record systems where patients can share data, can share their medical data with their providers, regardless of where they go. So you want to find a system that gives that interoperability with Open EHR, which is a standard that we used in building our application. It gives interoperability where a patient can give access to a provider wherever to have access to their data to facilitate the continuity of care. And then you want to use a system that encourages remote monitoring. These days, we have a lot of patients that use monitors, that use wearable devices to track their blood pressure, to track their heart rate. And we're actually getting to a space where these things will not only track, but send signals in case there's something, the vital signs are not where it's supposed to be. Again, that has a lot of regulations behind it, but that's where we want to get to. So this is another thing you should be looking at when trying to find a perfect telehealth platform. And then the patient report outcomes, the offline first design. This is something we actually thought about because in using a good telehealth platform, there are people who want to access the platform that do not have maybe internet services, that do not have smartphones that can do video consultations. You want to use a system that thinks way beyond using internet, and you're thinking of a system that has an offline first design, and even a system that uses short codes or the unstructured code services like the *126# that just gives you direct access from even a 2G phone. You want to think of that kind of system. And then the biggest one, of which you're going to be hearing a lot about today, is a system that is huge on using AI-powered automation. making good use of AI agents that will help facilitate the doctor's work, that will manage more of the administration side of things, giving the medical providers the time to focus on treating the patients. Now, one thing I want to call out is that all of these tools will not be important if they're not baked into the clinical process or into the clinical flows. So we can build an excellent tool on this side, but if this tool is not baked or integrated with the day-to-day clinical flows of our clinicians, they will not use it, and it's just going to be two different worlds. So that's one thing we want to call out. So from this slide, I'll stop sharing and I'll hand over back to Dr. Leno so we can proceed with the next phase of the presentation. Thank you.
Yes, thank you so much, Mrs. Achu. Mr. Bagmi, as an expert architect in building telehealth platform, what can you go through the process, I mean, briefly on how to create a telehealth platform that is compliant?
So thank you, Dr. Leno. So when we talk about telehealth, people should think about security first, communication second, and then best of all, we have this beautiful piece that we always put inside artificial intelligence, right? So people, when you look at a telehealth platform, what do you want? You want a platform that's easy to understand. You want a platform that's meant for the people. You build for people. You do not build you don't build for yourself. You're not looking at yourself as a customer. You're looking at the audience. I'll give you a typical example. We're building a telehealth platform for Africa. One of the biggest things that we have to think about is cultural differences. So you have to put together a bunch of things. Now, this is where you bring one, the technology, two, the platform, three, the communication, four, the agentic and AI flow. Now, all of that has to be controlled. So when I talk about building a good AI telehealth platform or telehealth platform, the first thing you want to think about is one, for the doctors, they have to be able to, the goal is for them to see more patients and do less work. The biggest complaint that most providers give is writing the subnotes. So when you talk about the subnotes, you talk about a doctor who sees a patient, right? As soon as he's done seeing the patient, he has to probably sit back at the end of the day and write a report on every patient. So a telehealth is supposed to serve the doctor to be able to see that patient, write those notes, and at the end of the consultation, he doesn't have to spend a single minute. Or if he's spending any time, 5 minutes max, and he's out of there, and he writes a compliant, well-accepted report.
Thank you. So you mentioned about agentic AI. What are some of the infrastructure challenges that the practitioners might face when using agentic AI?
So when you're building an agentic system, the first thing you want to think of is compliance. So AI, it's like a soldier in a war zone. He's like shooting bullets all over the place. So you have to control it. It comes with guardrails. It comes with knowledge base. So there's this technical word where we say retrieval augmented generation. What do you generate? What do you pull? When you're talking about AI, you have to feed him data. You have to make sure you don't just go to an open source, like let's say people who use ChatGPT, and you just go there and say, okay, I'm using AI in healthcare. No, we have to look for something that's compliant. And talking about compliance, I'm going to lean more towards a cloud provider that I use, AWS. And Amazon is amazing when it comes to like the health space. They have a whole stack when it comes to the health space. So they have their bedrock. That's where they host all their AI models. So you can build AI models. They're very compliant. And they have Amazon Comprehend. was going to help you with the ICD codes for the doctors, write your SOAP notes, transcription, and all of that come into place. And that is part of the agentic workflow. So you build an agent where a provider was trying to treat the patient. As soon as the consultation starts, he does the consent with the patient, he can record, and imagine a consultation that takes place for 30 minutes. And after the 30 minutes, you probably want to connect with the patient. So you go ahead to ask the patient, like, how's your son, how's your family, stuff like that. Now, with the AI agent, it's able to consider that part of the conversation as noise. So you can extract all of that. And at the end of the conversation, it creates a qualified SOAP note where the doctor or the medical provider just has to edit and submit. Remember, in this process, the AI is not replacing the medical providers. It's there to make the life easy.
Okay, thank you so much. So this will lead me to my next question about data security. So how is that implemented? How is the client data secured when they're using a telehealth platform?
So when you gauge on security, like I said, the first thing you look at is security. Who has access to what? So in the tech language, we say role-based access control, RBAC. You want to know who sees what and at what angle. Now, the fact that I'm a medical provider doesn't give me access to the patient's record. There's that idea of consent. So even though we can automate that flow, there's that idea of consent. Like, good example is the application that we built, Medicine. One of the things we do is when you want to triage a patient, I'm talking about just vital signs, everything like that. The patient, the provider he sends a request to the patient, am I allowed to access your medical data? And the patient comes back and says yes or no. Now, if the patient says no, then you have to proceed. Now, that's one aspect of it. The next aspect is the fact that the data is stored in transit and at rest. There's encryption that takes place. So we encrypt the data in the database, and we're also using one of the qualified medical data compliance called EHR. So we have open EHR at the back of our application where all medical data is stored in there. And that data is not accessible to us, neither is it accessible to the providers without consent of the patient.
Thank you very much. And what are some of the compliance, like here in a lot of practitioners in the US use HIPAA compliance? What are some of the measures or some of the compliance measures that the users have to pay attention to when selecting a telehealth platform?
Number one, you talk about the platform. Is the platform encrypted to begin with? Is the platform behind a secure network? One. Two, your data. When you talk about like America uses HIPAA, Europe uses GDPR. Now Cameroon has what they passed in 2025 December on cybersecurity, where they ask you to host all their data at rest. They wanted to host in the country. Now we're fortunate to have Amazon that does this regional, like Amazon has regions where you can store data closer to the countries. So that actually helps. Now, when you talk about compliance, you have to think about one, role-based access control, two, data encryption, three, you talk about the devices. Like if I'm using my phone to access my data, it has to have a timeout. So I forget my phone somewhere and I'm inactive for 5 minutes, 3 minutes, it locks. It locks. It has to have multi-factor authentication. So those are some of the guidelines that we use, and we have a whole sheet. I can go on and on about compliance and meeting compliance with the applications.
Thank you. And my follow-up question will go to Mrs. Achu. So if I'm a practitioner right now and I want to implement telehealth into my practice based on, Mr. Bagmi was very technical. Based on the information that he provided to us, how do I proceed? Let's say now I have a practice and I want to start implementing telehealth. How do I proceed? And before you answer, I'll let the audience post their questions in the chat so we can continue with the discussions. Thank you.
Thank you, Dr. Lino. So from what Alan was saying, we have mentioned a couple of items or things to take into account when you're trying to source for a good telehealth platform. So if you're already operating a medical facility and you need to use telehealth, the first thing you have to do is look out for a provider or someone that has an application that meets all these demands, that has a good design, that takes into account the interoperability aspect we spoke about earlier, that uses a system that is huge in security. Again, we have called out that using security is it's a big thing when it comes to medical data. And you want to go a step further to using a platform that is big on leveraging AI agents. We cannot say that enough. Everyone is switching to that space. And the important thing here is it is not replacing doctors. It's not replacing, it will never or hardly ever replace medical practitioners, but it is there to facilitate the work they do. Medical practitioners today, most of them spend more time in doing the administrative work, checking, making sure their patients are on time, writing notes, doing reports. At the end of the year, they have to do reports to submit to different governments or for regulatory compliance. That's where the AI agent comes in. So you want to be very intentional in selecting a kind of tool that is big on leveraging AI agents, because with the use of AI agents, it will facilitate a lot of things for you and you spend more time on actually treating the patient, which is what we want. So source a tool that has a combination of all these things, or if you're building yours, make sure these things don't just stand alone as a tool, but include them into your medical practices, into your clinical workflows, because that's the only way it's going to successfully work. If there are just a lot of too many tools that you put standing somewhere and not baking them into your clinical workflows, then it's really not going to work.
And doctor, if you would permit me, so we'll push this further to talk about EHR, electronic health record systems. So if you want to build a good telehealth platform, you think about who you're contacting with. So one, you have to have a platform. If you're building in a place like Africa that's multilingual, you want to have a well-trained AI agent. So it's not just, we don't just pick in any agent, well-trained. You want to talk about the whole ecosystem. Like if a doctor walks in, is he clicking like 9 buttons just to get to one aspect, or is it a straight flow? And then when you have AI agents, like we have AI agents in our system where before, for a patient to get his medical record, you have to go through different physicians. But our AI agent right now, you can just say, get me my medical records, and he prints everything for you. So it authenticates you. It knows you're the one because, of course, you logged in as you. So stuff like that, it has to do with facility, convenience. People have to be able to use it. So it's not about the technology. It's how user-friendly it is. So not too many buttons, not too many different, looking for buttons to do different things. And then one thing that we did is we did a very easy way where you want to book an appointment, for example, an appointment management system, where you can just go to your phone and then you tell the AI agent, book me an appointment with a clinic at 12:30 tomorrow. Shoot, he does.
So following up on that point, the agent will be used by the patient. The patient will need to use the agent through the telehealth platform.
So
it's only the practitioner that has access to the agent.
No, they all have access to the agent. And that's the aspect of the role-based access control. So in our system, we have agents that can recognize your role. So if you come in as a patient, the agent acts as an advisor, an assistant. When you're a medical provider, the patient as a clinician. So the agent acts as a clinician. So the agent is able to tell who you are. So it's able to authenticate. That's the aspect now of security. So the data that the assistant agent uses is not the same like what the clinician uses. And there's always that disclaimer: I am not a clinician. I am not replacing a clinician. I am just an advisor, but always seek expert advice from a medical provider. So yes, everybody using the telehealth platform has an agent, but the agent is role controlled.
Thank you. So I know Mrs. Achu really emphasized on incorporating agentic AI into telehealth. What my question now is to Mrs. Achu. What's the importance of including agentic AI? Why does it matter instead of just using telehealth without an agent?
Telehealth has its natural benefits, and telehealth would work well just using it by its own. Just standalone telehealth is perfect. But agents will just help facilitate things for you. I'll give a simple example with the use of maybe say Amazon Alexa, right? Before, if you want to check time or if you want to make an order or talk to someone, you have to, maybe if my watch is in my bedroom, I have to go take it to check my time. But with Alexa now, I can just a voice command like, hey, Alexa, what's the time? Or what's the latest news out there? And I get that information. That's the facility that we have with AI, and especially AI agents takes you more than that. Alain just gave an example. I can take my phone and go to my telehealth app, and I just talk to my AI agent. Can you find me the closest lab to my location where I can do a blood test for whatever results? Maybe you've been prescribed to do a blood test. And the AI agent is able to look in your network and find you a specific clinic close to you that provides that test and gives you results. So it facilitates things for the patients. So that's why we're really pushing for people to use a platform that leverages AI agents, because AI agents just makes things easier. Again, it will not replace a medical provider. And that's why you always have that disclaimer: check this with a medical provider or medical professional, and do not just rely on the AI agent. So the AI agents will help to do tasks that you normally do on your own, and it helps saves time as well, and will give you the same results that you had before.
And we have a slide that actually shows you with or without an agent. If you permit me, I'll just show you real quick. You'll see what it is with an agent and what it is without, like the regular telehealth. Let me know when you can see it right here. So this is what happens in telehealth when you just use it without an agent, and then you see how it speeds up the process. So it's like you gain a good, like, modern. So if you look at this, you can just look at a cost production on with an agent and without. And there's a lot of advantages that we can go on and on that aspect too.
Thank you so much. So in terms of people that live in remote areas with no access to internet or limited access to service or network, how will telehealth benefit these people? What type of platform will be appropriate for this type of people? Like people who live in remote areas with limited internet or network, or who do not use a smartphone?
I'll take a first step at that, and I'll hand over to Alan. I think the question you just asked relates. I'm looking at the chat here, and I can see a similar question or a related question. So we thought broadly with the application we built, which is Medicine L. We thought broadly, especially building for Africa. We thought broadly of people who do not only have internet services, but do not even have smart devices. So we still have a lot of people who still use like the 2G devices or their Nokia phones that do not give them access to like video consultations. So in that space, we thought about using an offline first service. And technically, I think Ellen can expatiate on that. But offline first permits patients to still have access to quality healthcare or access to a medical provider, even without the internet. Definitely there are some services that will not work, but the basic services like talking to someone will work. If like messaging a medical provider to get instant feedback will work with our offline first technology. So that's one of the aspects, the offline first. Now, the other thing we talked about is just using we call it USSD. The full meaning is an unstructured supplementary service data. And these are just codes where you would dial your *126#, and this will give you a menu that will say 1, speak to a doctor, 2, message a doctor, 3. So if you don't have a smartphone, you're able to use this USSD codes to still have access to a medical provider and get responses and feedback. And the question Gambe asked here is, what are some of the measures that will be taken in terms of HIPAA? Now, in the systems we use to build the telehealth platform has this compliance already included or embedded in it, meaning that everyone who is going to download the system, the telehealth platform to use, is already going to check the conditions or the terms and conditions that apply or that are HIPAA compliant or that are GDPR compliant or that are compliant to the environments in which we are working with. I don't know if that answers your question. Just let us know in the chat. Alan, do you want to add something on that?
So when you talk about using a third-party tablet or something, the advantages of that is it doesn't cache any data on a particular device. So we kind of give you that room to save password on the device if you want to. So it's an application. And what we did with the application is it's a web application as well as a mobile application. So you can get it on the web or on the mobile. So if I'm using a third-party device like a tablet or a laptop, as soon as I can get to the internet, I'll use the web. Now, the offline first works on devices where you have it installed. Now, so if I contact someone's third-party device, I can log in, put in my credentials, get my treatment, log out. And that's it. The computer doesn't store anything. So that's the HIPAA part of it. Now, another aspect is when we use the USSD codes, the short codes, we also have a WhatsApp. We also have an AI chatbot. We have an AI assistant too that you can call to book an appointment. You can call. One thing is clear. He's not going to share your medical data through the phone. He's going to book an appointment for you. He's going to do stuff like that. You reach, and that's where we get to the compliance part. We do not share medical data on phone calls or WhatsApp messages. No, it's not secure. It's not under our compliance measures. If you want your medical data, it has to be within the application, and then you can either email it to yourself or you can print it at your convenience.
So the agent and the telehealth platform are pretty much supporting the clinicians, that they're not taking the role of the practitioner.
Exactly.
And let's touch base on the cost effectiveness. Is it cost effective nowadays to use telehealth for practitioners here in the US or around the world?
So I'll chime in on that. So in the beginning of this whole telehealth, telemedicine platform, it can get really wild if you don't know what you're doing. But the good thing about the way these cloud providers, particularly AWS, Amazon, and that's the service we're using, they have these spot instances. They have these serverless instances where you pay for what you use. So for a guy who has a small clinic who's trying to use telehealth, you can pay for only what you use. But one thing is clear, it's going to end up being way cheaper than having some personnel. I'll just give you a typical example. Imagine you have a human staff Now I'll get into the cheap details. You get a human staff who's working for a whole year, let's say an assistant, and you're paying that assistant $60,000 a year, American dollars. You're paying $60,000 a year, and think about it. They should have at least by level law 2 weeks vacation, right? So you have to give them 10 days vacation. They'll probably be sick. They can only work 8 hours or 10 hours max, and you pay $60,000 a year. Now, when you go back and use the agentic workflow, if you get an AI assistant as your assistant, you spend around 5K on the low and up to like 20,000 on the high. And he works 24/7. No rest, no vacation, no time off. So if you want to achieve that, that's 3 employees. We're talking $180,000. But if you're achieving that with an AI agent, you're talking on the high 20,000. So if you do the math, it's a win-win. Plus, you achieve excellency. Like you're smooth and great, and they don't make mistakes. Unlike the human being who probably sleep on the job.
Now, what about for the patient, the client? So this was mainly towards the practitioner. Is there any financial benefits for a client to use telehealth?
100%. Take it this way. If I had to go to the hospital, and the benefits are all over the place. If I had to go to the hospital, and I'll take example, I have a scenario where I'm sick and I have a fever, but I just need to talk to a doctor. Now we factor a lot of things. Time that money cannot. You can't quantify time, right? So the time that I take to drive from my house to the clinic, then I have to wait to see someone, and give and take, we're talking 4 hours. But if I had a telehealth meeting with someone and I'm paying some money, that's already saving. Now, when you go to the payment, right, I have to put gas in the car. I'll probably still go pay money out there, and all I'm probably going to talk to the doctor is like 5 minutes. Now, time wasted, the energy, everything, then you still get the same outcome. But if I did the telehealth, I'll get the medication delivered in an ideal scenario. I'll get the medication delivered. I'll get to talk to the doctor, and I'll only pay for the subscription based on the platform you're using. So ideally, it's more convenient to the patients, it's cheaper for the patients, and it saves a lot of time. And for the establishments like the hospitals and the clinics, it empties your queue. Like your whole hallway would not look like a marketplace anymore, because people can schedule appointments, and you get to actually spend time offering treatment than doing triage.
Thank you so much. And I know you've been focusing a lot on doctors. I think you mean physicians, right? What
Yeah.
about other healthcare professionals, pharmacists, um, nurses, physical or occupational therapists?
So
How
so
do
yeah.
you apply that to the other allied healthcare professionals?
So when you talk about like a nurse is definitely she has to take like triage, do like vital signs and stuff like that. With an AI agent, she's able to talk to you, and the agent records. She asks you questions, she doesn't have to write. Now that speeds up the process. 1. 2, it gets to the point where when she's doing, like we have an example in our application called a Kanban board, where as she's talking to the patient, when she's done, she submits, it goes straight to the doctor, and the doctor sees that record in front of them. Now, she doesn't have to walk around with a book. She doesn't have to worry. She can come to work without a paper, without anything. You talk to a pharmacist. A pharmacist can get a clear count of his inventory without always going back to check. As soon as he can just check in everything he does, that AI agent would provide alerts, would provide calculations, and all of that will be done in a split second before they can even realize. And that goes to every department. So I keep saying doctors, but every department has a role to play in that atmosphere. There's an agent for every person, from the patients all the way to the doctors.
Thank you. There's a question in the chat from Megan Mitchell. How has accessibility been accounted for? So she's noticed that there is no recommendation about ensuring that the telehealth platforms have reached any minimum WCAG requirements. That is at least essential to consider in the US. So, well, people with disability that may have issues accessing a smartphone or reading through a smartphone. How is that accounted for?
Thank you.
So let me take that one. Thank you so much, Megan, for that question. And you're correct. Accessibility is a huge part here in the US. And what we've done is that we've aligned our platform to meet the WCAG 2.1 level AA standards, because we're ensuring that we have features like screen reader compatibility, colors like keyboard navigations, where patients that is blind, for example, can just use the keyboards, and then you have the voiceover where in navigating you can actually hear what button you are going to. That will facilitate you to have access to the same services as anyone else. So we did actually take account to that, and it's definitely something that we should be highlighting. So that's also including what we need to be looking out for. Here in the US is big. Where we built for Africa, we considered that to the level of which our users have the access. And we thought about even using all the way to like holograms that can actually speak to a user. Because back in Africa, we have people who do not speak the French and English, but we have tailored the application to speak local languages, where someone who is not able to read or write can speak the language you're comfortable with, and we have an agent that will reply, or a hologram that will speak that person's language. So yes, we do have accessibility. We've thought about it, and we're making sure that we're taking account to the colors we use, into making sure that the screen reader reads, the voiceover is responsive when any patient at all is trying to have access to their medical providers.
And to add to what you said, Cynthia, right now, our pre-consultation has a voice. Like a voice, like you can do pre-consultation with one of our agents, it has a voice. Like it asks you, why did you show up? You talk, he replies. Empathetic, he's very nice agent in the system. And what we did is we trained the agent, and that's something what actually is still doing, because right now the agent has this Americanized understanding. And now that we're going to other areas where people cannot even read. So it's not just about being blind or something. People cannot read, but they can understand what you're saying. So that's why we impose every chat in the system has a voice.
Okay, thank you. I hope this answers your question, Megan. So now, will you recommend any type of training for healthcare practitioners out there that want to use telehealth? Here in the US, more specifically?
Yeah, so if you look at they have a bunch of trainings under Amazon. Harvard has a lot that they're offering. Microsoft has a bunch. Like mostly agentic AI in healthcare is becoming the niche for a lot of people right now. So Microsoft offers different levels. Amazon is very big on the different levels of the healthcare for the clinicians, for the patients, they have a bunch of courses, and you can check them out, check their websites. You see a bunch on there. The WHO has a bunch on digital health, ethics, governance, and everything. They have a lot of documentation out there. For those who don't like to read, you can catch some on YouTube. If you want to start a pack, you can actually start with that.
Okay, thank you. So as we planning to wrap up, My next question is more about, in summary, what will you say is, let's say, the top 5 reasons why we should start using more telehealth? And as you know, there's a lot of research about the effectiveness of using telehealth in actually treating some of these conditions. And I also, based on the discipline, um, if someone, for example, has surgery, will telehealth help him pre-surgery or post-surgery? So there's a lot of research questioning the effectiveness of using telehealth. What is the best way to use telehealth? Do we use it to replace the face-to-face interaction, or do we use it along with the face-to-face interaction? How does that look like? The ideal way of using telehealth?
Thank you for that question, Dr. Lenoy. So we've spoken a lot. These two things go hand in glove. They have to work together for it to succeed. We cannot just depend on a tool, because there will always be instances where you have to go physically to see your provider. But what we're thinking in a broader scope, and we're thinking more of down the line, we want to get people more comfortable into preventive healthcare, where you don't have to get to a state where it's bad and you have to go in. So when we're using telehealth, is to make sure that people get to a mindset of, I can connect with my doctor just to check, right? I'm not sick, but just do controls, like tell him how I'm feeling, wear a device that can read my heart rate, just so that I don't get to a state where I will have to go into the hospital. But that doesn't negate the fact that these instances do not come up. We will always have instances where, you gave a good example, people will have to do surgery. For right now, we cannot, with telehealth, you cannot do a surgery from home. You have to go to the hospital. But where telehealth kicks in is that continuation of care. Pre-surgery, after the surgery, we need telehealth to facilitate. Imagine you just had a surgery and you have to drive to a medical facility for a follow-up. That's something you can sit from the comfort of your home, owing that you're still in pain, and you just have your normal follow-up with the medical provider, telling them how you're feeling or giving them updates on how you are feeling. So I think telehealth is very convenient. So it has to work together with in person. So it definitely has natural benefits. It was going to improve access to health. It's convenience in saving time. It's cost efficient, as we've mentioned. There's no cost you can put on convenience, on time, and it ensures continuity of care. That's a very big one. It could be pre, it could be post, and then it just facilitates a faster response time and early intervention. So off the top of my head, those are the 5 reasons that I will encourage people to use telehealth. Alan, you want to add?
So, so we mostly encourage people. Telehealth is mostly history. So one of the biggest problems we have back in Africa is people go to the hospital with no prior history. So with the introduction of telehealth, it helps a lot because we have that local hospital books. So it helps with your medical history. Here too, when you're using with the introduction of telehealth, where they're trying to unify a whole back-end system where data is centralized, so people now can get access to their medical records easily from the comfort of their phones, right? That's a good one, where we always encourage people to go with the telemedicine, because a doctor will perform, or a nurse or a medical provider would act way faster if they have prior history of your feeling. Now, another good thing about the telehealth is, in the past, we had people with internal diseases like blood pressure, heart attacks, those kind of things. Now, with these wearable devices, you can actually catch some of those things early, like early intervention. Now, with the aspect of the telehealth, telemedicine, it can send alerts. It can actually help alert a friend, a family of an attack. So stuff like that, it's growing. It's a growing environment. It's a growing environment that's going to even grow bigger. And there are a lot of solutions, like you rightly said, Doctor. There are a lot of solutions that are not there yet. Like post-surgery, pre-surgery, if you're going to surgery, you can do your pre-consultation at home and then go to the hospital, take the surgery, and when you come back, there's post-care, continuity of care. That's some of the things that the telemedicine will help you. Telehealth will really help in stuff like that. Continuity of care, sending alerts, sending messages, and then you can also control your own health. Your health becomes your destiny. You're able to see everything at your convenience. You don't have to reach out to a third party. You get all that data in front of you. So that's some of the things that we mostly encourage people. And in the big aspect is some of the diseases that people don't want to identify with. If you see me in a particular department in the hospital, you might, look at me as maybe I have this, I have that. But in the introduction of telehealth, you can also, it helps too with medications when you're trying to go buy a medication. Now, if you buy a certain medication, people would look at you like there's this stigma. But thanks to telehealth, you can order your medications and they come to you at the comfort of your house. So it's here to make life comfortable or easy, to make treatment easy. It's also helping with all these trained AI models. It's going to help reduce the gap between the medical providers and the patients. So we have all these agents that will help do some of the work that the other providers were doing, and it will prompt them to spend more time actually treating people than writing reports and all those kind of things. So yes, telehealth, and it's here to stay because there's a lot of improvements and people are doing a lot of research and inputting a lot of stuff that would really, really grow the ecosystem.
Thank you so much, Mr. Bagmi, for that statement. I think this is a good place to end the conversation. Thank you to all the attendees. Thank you, Mrs. Achu and Mr. Bagmi, for your input and your expertise into telehealth. If you don't mind, you can share your information in the chat if anyone would like to contact you at the end of this webinar.
Yeah.
And this webinar is recorded and will be available within 24 to 48 hours. Please share with your colleagues. Thank you, everyone.
Thank you.
Thank you.